Count Córa. Yes, I'd like to Kate O'Shea's Macquardas Gordon Harry Hara, Deputy Donnelly, and indeed Hannah Stott, Deputy Butler. Again, I wish them well and offer to work with them on behalf of our group here, because my goodness, there's some work to be done in the health, in the HSE. And I have to praise the staff and where they've worked in hard always, but especially now in the COVID. But this is going to have enormous impact on our health services. Bad enough as it was, but the impact now for people waiting for whether it's cervical smear tests, whether it's breast checks, whether it's bowel screening, whatever. They're all put back and put back and put back. Children with orthodontic treatment, children with eye problems. Deputy Michael Collins and he raised busloads up and down to Belfast every weekend with people going blind just for a simple operation. That's been taking place. Our NGOs go out, medics go out with NGO organisations and do it in the deserts, inside in tents and places, makeshift hospitals for third world countries. And we can't do it at home. In spite of the fact that almost 18, 19 billion is going to the health service every year now, anyway. I don't know when I welcome the extension to the ages of the medical cards, because it's a charade. Because the GPs are under enormous pressure. A person now can't get a GP. My own daughter got a sting the other night in her hand, and the day after it was swelling and swelling and swelling, and she tried to get her GP, couldn't see her, was into A&E. I mean, COVID is one thing, but we have to treat our people. COVID, I mean, I have huge issues around it. It's COVID, 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 and forget everything else. People get sick, and people do get sick, and the amount of sickness and the amount of people that will die, unfortunately, because of neglect now and because of non-appointments and non-screening and non-checks, is sad. And I related some of the cases before to the previous minister about people and with private healthcare insurance and everything else. So, Minister, our ministers, you have a hard job in mental health and older people as well. You have a hard job, but I'm here to help you. But we need fundamental and radical reforms in the HSE and the Department of Health. Fundamental. I mean fundamental, because when Belfast and indeed the Northern Ireland Assembly, the Northern Ireland people, they recognise the Sabbath more than we do down here. It was an anathema to work on the Sabbath, but now they can do fleets of operations on the Sunday. And it doesn't make sense that our theatres are closed here in this country, in the south of the border, for weekends, bank holidays, the whole shebang. We saw it during the height of the COVID, where Inford, the lab in Kildare, didn't get a test sent into them from 12 o'clock on a Friday, the bank holiday in June, till Tuesday morning. They just stop. Every Christmas, without fail, we see a disaster in January, because people are just, the holidays are taken, the place closes down, and they go off, and the whole thing the system is shut down. There are nurses, frontline, there are doctors, and there are, of course, attendants, everybody else, and management who run the hospitals in those times, but the vast majority of people take their holidays. If it's running like a business, it should run. So, I mean, all this carry on with extending the free medical cards now to under 12s. Is, it's useless, because you can't get GPs, you can't get in. And the poor woman in our Mendes inside waiting and they're paying, they're 60 quid if they can get in or whatever, they're overrun, they're pushed out of the way. So we need to have a fundamental re-examination, and I believe that every patient should pay something to a medical card and a prescription. We brought that in some years ago. Now the charges on so many items is too much and it's too high, but there needs to be, some kind of a re-evaluation here. The GPs are under enormous pressure, and the GPs can do so much. And I brought the last minister, and I invite you again, Minister, to come down to Clonmala, the Vale of Honey, someday, maybe during the holidays or whenever, and come to the Mary Street Medical Centre and see the wonderful scanning equipment that they have there, that they could do ultrasounds. And the Minister Harris came down, and they applied for a contract to do this, because you're waiting 6 months for one in the hospital, maybe 7 months. They could do it here, connected onto the University of Limerick, and read the scans, professional people, and it would take those people away from the A&Es. Simple. And we got the contract after I raised it all day in, day out, after numerous high-level meetings, including the Minister, and we got it for a 14-day contract, probably the shortest contract was ever issued by the HSE, and then it was pulled after 8 days. No funding. Things like that, stopgap measure, the expertise is there in the private practices to be used to help the situation. So that has to be done. And Minister, please, when are we going to stop the spending for COVID? I have a PQ back last week, and the spending is just mind-boggling and frightening. Just money thrown at this, that and the other. This will all have to be paid back. So I'm asking you to put on the brakes and have accountability there. Gormahagut.
Thank you, Deputy.